Good morning from Southern California. This is Dr. Anthony Chang for AI Med, and we have an AI Med talk today with my friend and colleague, Dr. Piyush Mathur from the Cleveland Clinic. Welcome, Piyush. So how are you faring? How are you faring with the pandemic as an anesthesiologist?
Yeah, as an anesthesiologist and intensivist, I think we have been at the forefront of this, extremely busy, both in formation of various policy recommendations and patient care. But I think we are doing well.
Well, thank you so much for what you do, but also for your help for AI Med in terms of trying to have clinicians understand AI and its application. So you and I talk about what inspired you to go into artificial intelligence more, and you were telling me about your value on safety and quality of care. So how did you foray into artificial intelligence?
Yes, so my introduction to artificial intelligence was actually trying to solve my own data problems. I had been the quality officer with Anesthesiology Institute at Cleveland Clinic for around 4 or 5 years and done my training, that is my fellowship in quality. And then I was getting increasing volumes of data, and I didn't know how I could manage that increasing volumes of data in a better way. And also, how could I implement certain decision support systems which had evolved over time period in the EHR? So I stumbled upon machine learning and artificial intelligence. I had no computer programming background at all. I had been a clinician most of my life. And I started to understand that better. And I met you. I found AI Med, and I was inspired. I came to the December annual Congress that is held in California. And just talking to you and learning from yourself and many others who were there, as it is a great networking opportunity, I was able to understand the basics of machine learning and AI better. I was able to understand what are the future steps I need to take. And from there, it's just taken off.
Yeah, no, you've done amazing amount of work in this area, starting from scratch, basically, and we'll have to talk about that at a future date. But what's been your evaluation and impression of doing artificial intelligence as a practitioner, especially in the area of data? So you were talking about data.
Yeah, so I think when we talk about machine learning or artificial intelligence, we talk about big data. But one of the challenges as we all face in healthcare, due to certain concerns with privacy and security of patient data and information, is availability of data. Thanks to some of the work that various organizations, including AI Med, which is very patient-centric. I'm really impressed every year how the annual meeting starts off with a patient story and the patient there at the podium. I think that data availability is getting better, but it's still siloed up. When you talk about big data, we truly don't have big data. We still have a lot of silos of small data.
Yeah. And also you were talking about validation, right, of the data.
Yes, so it's really inspiring to see, especially in critical care, we published about it, the amount of knowledge growth that we have seen, the amount of research that has taken place. We have seen tremendous amount of algorithms that have been developed, and some of them have gone on to the application side also. But there's extremely limited external validation of some of these tools. And I think that's a big challenge for us to overcome. And that's where we need a lot more clinicians engaged and informed in helping us overcome that challenge.
Yeah, believe it or not, I in my previous life as a cardiac intensivist, I spent 25 years talking about a supercomputer that can accumulate everyone's data and all the experts' knowledge and give you advice in real time, So I think we're getting closer. How long do you think it'll be before, Piyush, we give you a software or machine intelligence that can help you real time with all the data? For instance, during this pandemic, how long do you think will be before we get to that point?
Yeah, if I had to speculate, I'd rather speculate on the stock market. So I think
more predictable.
Yes, more predictable, I guess. But I think it's coming. Some of the tools on the machine learning side and some of the understanding on the clinician side have evolved to a great extent. And I'm very hopeful that in the next 5 to 10 years, you'll see some of these cutting edge solutions being implemented and used.
I think this pandemic has been, in a way, an accelerator for us to realize just how important real-time application of data and AI would be. So, Piyush, thank you so much for your passion on AI and helping myself and others with the artificial intelligence movement in medicine, and also thank you for what you do as a clinician for the many, many patients that you serve. So thank you for spending the morning with us today, Piyush.
Thank you, Anthony. Thanks for being such an inspirational leader and everything that AI Med does for us. Thank you.
Thank you. Bye, everybody.